I never thought that I would hear those words, "You'll probably have trouble getting pregnant." Turns out, I wasn't alone. In 2002, according to the National Center for Health Statistics, at the Center for Disease Control and Prevention, about 7.3 million women in the United States, ages 15 to 44, had trouble getting pregnant or carrying a baby to term. I want to tell you about 3 important aspects of dealing with infertility. Often there are physical aspects that go along with infertility. Many times there are physical reasons for infertility in women, such as uterine fibroids, blocked fallopian tubes, or diseases such as polycystic ovarian syndrome. Determining if there are physical reasons for the infertility is one of the first steps in treating the infertility. There are procedures such as ultrasounds, blood work, and x-rays that are done while the uterus and fallopian tubes are filled with dye. There are common tests that are done when trying to determine the reason for the infertility, why she's having trouble getting pregnant. Part of trying to get pregnant is taking pills or even giving yourself injections, which can have physical side effects such as acne, breast tenderness, headaches, restless feelings, irritation or inflammation at the site of the injection, and just overall moodiness, according to About.com. There are other side effects that a woman's doctor should speak at length with her about when taking fertility drugs, and those are the chance of multiples while taking the drugs and something called ovarian hyperstimulation syndrome. Ovarian hyperstimulation syndrome is when the ovaries become enlarged and they're filled with too much fluid. This can be very painful and sometimes even dangerous. According to WebMD.com, most cases are mild, but they can be severe, and symptoms can range from discomfort in the abdomen to a stroke. Proper monitoring is definitely required in order to ensure that the case does not become severe and require hospitalization. Sometimes if pregnancy is achieved, the pregnancy can take a major toll on the mother's body, and bed rest may be required for the health of the mother and the baby. Long-term bed rest, however, can weaken a mother's muscles and can make recovery after giving birth a longer process. The financial aspect of infertility is definitely a burden when one wants to try to have a family, and the thought of medical bills can stand in the way. There are many appointments often needed when trying to have a baby, and it may be surprising how many, sometimes 3 or more a week. Each of these appointments costs several $100s depending on the doctor's fees. However, these fees usually don't include any tests or procedures that are done at each appointment. Every insurance company has their own things that they cover and don't cover, so for some couples, infertility costs more than for others. Medications can be extremely expensive and can often cause sticker shock when ordering the medication. Clomid is a pill that you take by mouth and is often the least expensive medication to try. However, the medications needed when giving yourself injections can start at $500 or more, depending on the amount of medicine that you need per cycle. Insurance companies may or may not cover the medicine, which is something to look into before starting treatments. Some procedures that may be needed when trying to get pregnant are numerous and costly. Ultrasounds, blood work, insemination, and in vitro fertilization, to name a few. Now, these can range from anywhere $20 for blood work to $10,000 or more for IVF. Travel expenses are a definite aspect of infertility that many people don't think about. In North Dakota, we have 2 reproductive endocrinologists that are located in Fargo at Medicare Hospital. Even though these doctors travel to some other hospitals in the state, it can absolutely be a very long drive to go see them, especially if you live in the middle of nowhere like I do. Sometimes the visits even require an overnight stay near the fertility clinic. My husband and I traveled 1 hour and 30 minutes each way, sometimes 3 to 4 times a week for 3 years trying to get pregnant. Lost work time can also be another big factor when you need to take time off work for appointments or for procedures such as insemination or in vitro fertilization, when the doctor would suggest that you take time off afterwards. The emotional aspect of infertility is probably the hardest of the three that I've mentioned. The feeling of being alone can be very common. Feeling like no one else could possibly understand what you're going through makes infertility very, very hard. Since infertility is often a very private issue, many people won't discuss it. But some doctors suggest that you join a support group or you find an online message board that can help. Meritcare.com suggests the website Resolve.com for couples to find support, and even an online community where couples can go to talk with other couples that are dealing with infertility. Defective is a very common term of how a woman may feel, especially shortly after she finds out that she's facing infertility. So many women believe that they are put on this earth to have a family and to give birth to a child, and when they learn that that may not be physically possible for them, it can be very devastating. Family and friends may do their best to offer support, but unless they themselves have been through infertility, it can be hard for them to relate. They may mean well, but will sometimes say the wrong things when they don't know what to say. Remembering that family and friends mean well is most important. Even if they have said something that wasn't quite appropriate, chances are it wasn't intentional. A very scary part of trying to get pregnant is the knowledge that miscarriage is a possibility. Miscarriage is when a pregnancy ends on its own, sometime within the first 20 weeks of pregnancy. Women who have trouble getting pregnant are sometimes at greater risk for miscarriage, depending on the reason for their infertility. Sadly, miscarriage happens more often than people think. According to the American Pregnancy Association, between 10 to 25% of all clinically recognized pregnancies will end in miscarriage. Miscarriage can happen for many reasons, but within the first trimester, the most common reason is chromosomal abnormality in the baby. The constant worry of if the cycle will work and if it will result in a successful pregnancy is a very emotional part of the infertility issue. You wonder if the cycle will work at all, and then worry if the cycle does work, if it results in a pregnancy, will that pregnancy be viable? After investing so much money, time, and emotion into a cycle, it is impossible not to wonder about the what-ifs. All in all, even with all the physical, financial, and emotional struggles of battling infertility, millions of women every day keep fighting in the hopes that they can overcome their infertility and give birth to a beautiful, healthy baby. Thank you.